which is May. Okay. Thank you for allowing us to come in and just share a little bit about what's going on with Mental Health Month. May is Mental Health Month is a tradition that was founded in 1949 with the establishment of Mental Health Week. The National Mental Health Association in the 1960s expanded this to a full month with the blessing of all the mental health providers and consumers. The goal of the Mental Health Month is to increase public understanding of mental health issues, promote mental health recovery, and promote living healthy lifestyles. The Mental Health Association of Lebanon County and Compeer are here today to share with you the impact of mental health and mental illness in Lebanon County. Some statistical information that I'd like to share with you is that first part is national statistics that come from the National Institute on Mental Health. According to their statistics, 26.2% of adults, or approximately 1 in 4 U.S. adults, in any given year are diagnosable with one or more mental health disorders. Out of that, 5.8% of U.S. adults, approximately 1 in 17, experience a seriously debilitating mental illness. 36% of this population is receiving treatment, and 12% of the population is receiving minimally adequate treatment. 46.4% of U.S. adults, approximately 1 in 2, will experience a diagnosable mental health disorder in their lifetime. The average age of onset is 14 years. 46.3% of U.S. adolescents aged 13 to 18 years will experience a diagnosable mental health disorder in their lifetime. 21.4%, 1 in 5, have or will experience a severe disorder in their lifetime. 13.1% of U.S. children ages 8 to 15 years have a diagnosable mental health disorder. For Lebanon County, our Lebanon County Mental Health Program serves around 700 adult individuals living with serious mental illness and around 300 children and adolescents. Statistics from some of our providers: Philhaven Behavioral Healthcare Services is currently serving 9,842 Lebanon County residents. Ponessa Counseling and Associates served around 700 Lebanon County residents in 2011. Community Services Group served 17 Lebanon County residents in 2011. From November 2010 to January of 2011, there were 271 Lebanon County Correctional Facility inmates receiving psychotropic medications. 21,151 Lebanon County residents are eligible for medical assistance. Were eligible for medical assistance in the calendar year 2010. 21%, approximately 4,441 individuals received behavioral health services in calendar year 2010. This was up from 17.9% in calendar year 2007. In fiscal year 2010-2011, Lebanon County Mental Health Services had a budget of $3.6 million for mental health services to individuals with serious mental illness. In fiscal year 2010-2011, the medical assistance behavioral health care budget was $19.4 million for Lebanon County. Mental health disorders are widespread, and Lebanon County is no exception. The total number of Lebanon County individuals served via the mental health providers, based on these statistics, is approximately 10,559, which, based upon the national statistics, represents 36% of the population needing mental health treatment. That means that we have a total population of about 30,000 individuals in need of mental health services in Lebanon County, which represents 24% of the population of Lebanon County. If the national statistics were applied to a physical health illness or disease, we would be told that we have an epidemic on our hands. Ironically, the statistics for mental health disorders continue to rise, and the funding for treatment continues to decrease. We can no longer afford to turn our heads when it comes to mental health disorders. Mental health disorders are the top cause of disability in the United States. Mental health disorders are increasing in our military and their families. Mental health disorders are still being quenched by stigma. There is hope. We know that early detection and treatment reduces the debilitating effects of mental health disorders. We know people can and do recover from mental illness, and prevention of mental health disorders is possible through resiliency programs and education on good mental health. As we are faced with continued cuts in funding for the treatment of mental health disorders, we must find ways to more effectively and efficiently use our dollars. We must develop treatment plans and programs that empower the individual and promote recovery. One such program that does that is Compeer, and that's why I've asked Ida to be here tonight to talk a little bit about Compeer services.
I'm just curious, how many people have ever heard of Compeer? Oh, a couple. Okay, that's good. It's a pretty well kept secret in Lebanon, but I'm trying to get the word out there. This is a program that was started 39 years ago in Rochester, New York, and it's been here in Lebanon County for 13 years. And you're really lucky to have this program here. What we do is very simple. We recruit and train volunteers in the community to become friends with somebody who is in recovery from a mental illness. Simply to be their friend. And I've been in the mental health business for 30 years, you know, as therapist, administrator, whatever. And I do know this, in order to help people recover and stay on the road to recovery, you need to know your client. And what's happening is because there are so many people needing services, they're getting less and less services. This is a simple solution to help people stay on track. What we ask the volunteer to do is to spend 1 hour a week with their Compeer friend. And what we do is we match people up that have the same interests, same age, and same gender. So what happens is we're sort of like an adjunct to mental health treatment. This match gets to know each other. The volunteer will fill out a monthly report letting us know what they did, how it went. If we see any change in behavior or notice anything, we can alert the case managers. And what we do is we photocopy those reports and we send them to the case managers so they have them. But a friend will be able to indicate early if a behavior changes. And if you can resolve that issue early, it doesn't escalate and it doesn't turn into a hospitalization. It costs about $150,000 to keep a person in Warrensville State Hospital. It costs the Compeer program $1,500 to sustain a match for a year. And what we do is the first year we follow that match very closely, so you know, to have better success. So in terms of, you know, budget cuts, this is such a good fit and such a good help to the mental health system. The volunteers, well, sometimes the people that are in the program, the clients that are in the program, they're doing really, really well in the recovery, and they'll turn around and they'll be in volunteer. And that helps them stay in their recovery.
How many active matches are going on now, roughly?
I'm sorry?
How many active matches do you have?
Right now we have about 30 active matches, and we do have, about 15 people on our waiting list. And some of those 15 people really are not ready for a match. They come to our socials. We offer 2 socials a month. And it's just so the matches can get to know each other better. We recruit volunteers there. If somebody's interested in volunteering, we ask them to come to a social, see who we're working with. Sometimes somebody needs to, trust is a big issue. You know, they don't really want a friend because you know, they're not used to trusting somebody. So, and that's just a symptom of you know, mental illness.
Are you a United Way agency?
We are a United Way agency, yes, yes. So we get like 1/3 of our budget from United Way, 1/3 from MHMR, and then I'm out writing grants and doing fundraisers.
The main reason that I asked Ida to come was because so often we hear of the unsuccessful situations, like the large population of people on psychotropic medication in prison, or people who are constantly going back in the hospital. Compeer is one of those programs that has progressed to the point where we're taking consumers with serious mental illness and we're actually turning them into productive, responsible individuals in the community. And so part of what Mental Health Month is about is not only showing what isn't working, but also talking about the things that are working. So in conclusion, we're just asking for your support in our efforts to encourage people to live well and to provide better and more effective services to those individuals living with mental health disorders, especially those living with serious mental illness. They're the most vulnerable, and they're the ones that basically require the most support in